Good morning and Happy New Year, everyone. We're thrilled to have you here for today's COHTAC Share and Learn called The Nuts and Bolts of Using Photovoice in Public Health. I am going to go ahead and get us started. So a little bit of housekeeping before we jump in. So as usual, we record all of our webinars and we post them on our YouTube channel. We share the link out with all of you afterwards with slides, with Q&A, with all the things that are shared today. If you have any questions, please put them in the chat box. We'll keep track of those and we'll have some time reserved toward the end to answer questions. But if things come up, burning questions, you can always ask them in chat. And then toward the end of the presentation, we have a poll that we'll do for evaluation. We also have a link for any comments you'd like to share with us about how you like today's webinar. And I think that's about it. So I'm going to jump into the learning objectives and the agenda. So Jennifer Felner is with us today to run through what Photovoice is, how it can be used in public health practice, and tips and resources to successfully carry out your own Photovoice project. Jen is an associate professor in the School of Public Health at San Diego State University and a core investigator in the Institute for Behavioral and Community Health at SDSU. You can read more about Jen in the link I'm posting in the chat right now. Okay, and then we'll end today with several announcements, and we'll also be looking at Smile California National Children's Mental Health Month materials. So that is to come. So I just wanted to start with why we're talking about Photovoice today, and that is because it is part of your success story deliverables in the LOHP work plan. So what you have in the italics on the screen there is verbatim from your work plan. In sharing your success stories. And then in the box there are all the different deliverables and activities for the success story dissemination plan. So this is one method that you can be using in telling your success story. And so we wanted to invite someone with experience in using this method to tell us all about it and how you can do it yourself. So with that, I am going to go ahead and pass it off to Jen and looking forward to learning alongside with you.
Thank you, Aubrey, and to your great team. Good morning, everyone. As Aubrey said, I'm Jen Felner. Jen or Jennifer, both are just fine. It's so nice to meet you all and be with you all. I saw already some comments in the chat. It looks like we've got some SDSU alums and or fans in the house. So really good to see all of you and my SDSU colleagues. So let me go ahead and share my screen. Always takes a minute. Okay, can I get a thumbs up or just okay, thanks, Aubrey. All right, looks great. So I know Aubrey's going to help me manage the chat. I'm also going to keep my eye on the chat to the best of my ability, but I want to keep on time so that we have lots of time for question and answers. So I'm going to welcome you to share any feedback or comments or questions in the chat. And if I'm able to get to them and they go with what we're talking about at that moment, I can definitely address them. And there'll be some times where I explicitly ask, please share your thoughts in the chat. And otherwise, really excited to answer any questions and really dialogue with all of you in the latter part of the presentation. So as you already know, today we're going to talk about the nuts and bolts of Photovoice. I absolutely love this methodology, this approach in general, and especially in public health. It's something that I feel like anyone can use, anyone can learn how to do, and create a project that will be useful for whatever their needs are. So there's definitely some structured ways to do this work that we'll talk about, but in general, it's a really flexible approach. And I say this at the end of the presentation, but I'll say it now as I'm introducing myself, which is I am self-taught. I never took a class. I didn't go to any workshops or webinars on this. I got my hands on every online resource I could. I talked with friends and colleagues, and I did my own Photovoice project probably 7 years ago at this point. And it's something that now I have the honor of sharing with you all kind of my experiences and how to do this work. So again, it's great that you're here to learn, but anyone can learn how to do this even on your own. So if that helps build any confidence with how to use this methodology, I hope you keep that in mind. So here's what we're going to talk about in our time together. the who, what, where, when, why, and how of photo voice. So a lot of the kind of what is this methodology? How has it been used? How can you use it? Why might you use it? I'm going to spend some time really going over the project, the first project that I used Photo Voice on back in 2017, which is the Action for Health study, which was a community health assessment in San Diego at the height of the hepatitis A outbreak. And for those of you living in California at that time, probably many of you, I know you're all working really diligently in public health. So I'm sure you remember that really challenging time around the Hep A outbreak. So we had the honor of using Photo Voice during that time. I'm also going to briefly review with you a project that I was not involved in, but I became aware of as I was researching Photo Voice over time, which is the Asthma Mitigation Project. And that was a project that really was meant to highlight success stories around California related to asthma intervention and prevention programs. And then we'll talk a little bit about sort of some really specific processes in Photo Voice. I know that one of the questions or the things that people were looking for when you filled out the registration form was, what does a schedule look like? What does a timeline look like? And so I'll give some ideas and some suggestions for that. And then also lots of resources, again, just so that you have the tools that you need to do these kinds of projects with or without, guidance from someone outside of your team. So the history of Photo Voice, I think in public health, a lot of people have heard of Photo Voice. Often people might have an idea of what it is, or they've seen one report or paper about it. But a lot of us maybe don't know about the history of this methodology and sort of how it came to our field of public health. So something you also may have heard of, which is sort of a precursor to public health, is something called photo elicitation. And this is typically a research method where people are gathering photos as data in some kind of a research project. Usually, photo elicitation is a researcher or an investigator driven initiative. Excuse me. And photos are used to enhance some sort of data or understanding of an issue. And it doesn't necessarily mean that participants are gathering the photos. It may be that researchers are gathering the photos, or they're really closely directing research participants on what kinds of photos to take. So I think it was in the 80s, 90s, enter something called photonovella, which later became known as Photo Voice, which kind of really turned around the way we thought about how we could use photography in research and in public health practice. And in this photonovella, now Photo Voice methodology, people were using photos plus stories and narrative as vehicles for change in research that's really engaged with community members and community partners. And so I think that the real big difference here is that Photo Voice used to be Photo Novella, is really more about how can we tell the story of people's experiences? How can those people tell their own stories? And how can we use those stories to create the kinds of changes that we want to see in the world around us and in public health in particular? So the big piece of Photo Voice is really that it is meant to be community engaged, and community can be defined in a lot of ways. It's meant to be community driven, and really most importantly, focused on action. What are we going to do with this information that we have? A quick quote from kind of the foundational landmark publication in public health that talked about photonovella, now Photo Voice, from Wang and Burris. Anyone who's had any training on Photo Voice, maybe those of you who did any formal training in public health, maybe during undergrad or master's in public health, you've probably heard of Wang and Burris, who writes a lot on this topic. And they describe photonovella as a needs assessment tool, providing a creative and appealing method. And in a project they used, community members could document health issues of greatest concern, providing an opportunity to document creatively and to discuss the community's problems, concerns, and hopes, and communicate them with policymakers. So again, really kind of flipping on its head this idea of photos are just data to help researchers, and instead saying photos are a tool for empowerment, community engagement, and some sort of policy level change. So what are the purpose and goals of Photo Voice? So I've talked broadly about what Photo Voice is, but kind of to give you a really concrete definition, Photo Voice can be described as a process in which people or groups use photographs and or videos. So it doesn't just have to be photography, it can also be videography, and narratives to document their social and physical environment and their experiences, and to express their thoughts about them. So the goals of Photo Voice are threefold: to enable people to record and reflect their community's strengths and concerns. So we're not just focused on weaknesses, right? There's so many strengths and assets in the communities around us and that we're a part of. Photo Voice can really help highlight and honor those. Another goal is to promote critical dialogue and knowledge about important issues. So that could be dialogue and knowledge among those who are involved in the Photo Voice project, but also those who are consuming or seeing the information that comes out of a Photo Voice project. And then the last goal, and perhaps the most important goal, is to influence policy and or social change. And we can think of this as big P policy and little p policy. And what I mean by that is big P policy might be policies at a federal level, policies at a state level, even policies at a local governmental level. And then little p policy, not less important, just a different kind of policy, might be policies within community-based organizations, within other kinds of businesses and local organizations or different groups. So really we can think about this as changing governmental level policy, but also policies within community-based organizations. So, because we're a group of folks in public health, we love to talk about the social ecological model. That's one that's so important for understanding how individual health is really nested in our social and environmental world around us, whether it's interpersonal relationships, organizational factors, community, and social and policy factors. So, I really like this article by Strack et al. When you get the copy of the slides, you'll also have this there if you want to look this one up. And they really map on Photo Voice to these different levels of the social ecological model to consider how can using Photo Voice methodology or running a Photo Voice project have different levels of influence. So at the individual level, they think of Photo Voice as a photovention, like a Photo Voice intervention, and which groups of people, those involved in the project, might engage in some sort of change or have new knowledge or new behaviors or new hopes and aspirations just by virtue of participating in the program. Then we can think of it at a little bit of a higher level, something like community health assessment or community assessment around needs and assets. And so that is really the classic use of Photo Voice is how can we understand what's going on in a particular community or for a particular group and figure out how to address any needs and leverage and build and sustain any assets. Can also be used for community capacity building. So, really thinking about how using Photo Voice might be able to institutionalize or sustain any kind of community or organizational level factors. And so, it can even be used to sort of build skilled and expertise across an organization or across a group. And then again, really thinking about how Photo Voice can have a social and a public policy impact based on the actions and the recommendations that might come out of a project. So one Photo Voice project could really be used to implement or affect these kinds of things or factors rather across the social ecological model. It's not that each project is only affecting one of these. You can really think of these broad impacts. So Photo Voice applications, as I mentioned, kind of the bread and butter, the original use of Photo Voice has been in community health assessment, sometimes called needs assessment, also in community health improvement planning. And so that is how I've used Photo Voice in the past. But there's other ways that people are using Photo Voice. And I think many of you on this call are thinking about how you're going to use Photo Voice in other ways, like in implementation and dissemination efforts, using Photo Voice to be able to share your successes, share your challenges, really highlight important work so that other people can learn from the work and also create some sort of body of information about what works and how to address different health issues. So, are there any other applications that you all are thinking of that Photo Voice could be used for? Any other kinds of projects or initiatives, either that you've seen or just that come to mind? And if you have any ideas, please put them in the chat. And there are no wrong answers. And you might say, well, you're the one who's supposed to tell me that. But I do welcome any thoughts. Healthy food retail, great. So, thinking about how you could use it to demonstrate what that might look like or highlight some opportunities for healthy food retail environments, excellent. And on that note, Photo Voice is really nice for things we can see. It's good to also document social and interpersonal processes, but when there's something we can look at and really tell a story about, like a food retail environment, Photo Voice can be excellent. Any other ideas that folks want to share? Monica says, I'm working with my local FQHC to share their successes of FV application for children in the medical setting through a video. Excellent. Tobacco waste, great idea. That's a really good one too. SSBs to piggyback off of the healthy food, wonderful. Documenting health disparities, excellent, Alexis. Yes, I think Photovoice is particularly good for really thinking about what are the inequities, what are the disparities in the different communities that we serve and may be a part of, and how can we use Photovoice to really highlight those disparities and what we can do about them. Great. And folks, feel free to keep adding in the chat if you have other ideas now or as we're working through this. Okay. And I've shared with you on the right of the screen just one example. This is one I found online that I thought was a really nice picture of what Photovoice can look like. And this was a project through the Morehouse School of Medicine in Atlanta, where I'm from. So fun to see it from my own hometown. And these were photos to help East Point, which is a neighborhood in Atlanta, show the community's challenges, but importantly, also their joys, right? So I think that sometimes in community health assessment, we want to focus on the needs because we want to serve, we want to help, but also again, really honoring and showing those joys and those assets can be really important. So why use Photovoice? So you probably have a lot of ideas of why to use Photovoice. One, maybe because it's part of a project and it's already, been sort of determined you will or you need to use Photovoice for this project. And usually, if that's the case, there's a reason that whoever designed the project or who's funding the project wants to see that. And a lot of those are probably grounded in the reasons that you might use Photovoice in general. One is that photography is accessible even for those with few resources. So the majority of my work for the last decade of my career, but particularly recently, is around addressing the health needs and bolstering the health assets among people experiencing homelessness, particularly young people dealing with homelessness and housing insecurity. And when I was originally thinking about Photovoice and how might I leverage Photovoice in partnership with people dealing with housing instability, I thought, well, are people going to have phones or are we going to be able to get funds for cameras? And I will say the answer is yes, yes, and yes. Even people with very few resources often have access to a phone that might have a camera. And or we can get relatively inexpensive cameras that we can share with partners and participants to engage in Photovoice. Also, a lot of people, if not most people of all ages, know how to take a photo. Doesn't mean they're confident in their photography skills, but they have some kind of experience taking a photo with a disposable camera, taking a photo with their phone. So it's really accessible. Building on that, photography is fun and creative. It's a way that a lot of us probably engage in art, and we don't think of ourselves as artists, but we take photos all the time of our friends, of our loved ones, of our pets. That's my biggest photos are always of my two cats, which are always doing something very, very cute. And I feel that instant reward of seeing, look at this documented in my, the little thing I get to hold in my hand, my phone. How can I show these photos to the world around me, whether it's through social media or in person, and people can immediately sort of get what I'm trying to communicate. And so that is why Photovoice and using photos in community assessment and in other kinds of projects can be really helpful. Minimal training needed. As I mentioned, I didn't have any formal training in Photovoice. And also, I was able to get access to the resources I needed to be able to then train partners and participants that I was working with in a Photovoice project. It's not hard to sort of teach people about what are the basics of quote unquote good photography and what are the ethics around collecting photos as data and or information that's used as part of community health efforts. And as something probably all of you have heard, a famous quote is a picture is worth 1,000 words. So that photo can really go a long way in communicating something that a really long report, a bunch of charts and graphs just might not get across to the people that we're trying to communicate with. Some other reasons for Photovoice. Images can be understood regardless of language and culture and other factors. That's really important, especially for those of us who might be doing work with communities that use different languages, have different language abilities and or preferences, working across different kinds of cultures, countries, places in the world. It can be difficult to deny reality when it's staring you in the face. And when we are trying to make change, we are trying to hold policymakers and people with power accountable. It's hard for them to ignore something when we can actually show it to them. So photos, again, can have power that I think sometimes, quote unquote, hard data and numbers can really get lost. The photos are hard to ignore. Similarly, photos and narratives about people's experiences can be used for accountability. So those kind of go hand in hand. And photography can facilitate communication without requiring people to be present or speak in real time or to be in a specific place. So it can be really good for our digital world in which, we're doing this right now. We're not all in the same place, but we're all together. And also there may be times in which you're working with partners or community members when maybe they don't feel comfortable giving up and doing a big presentation or doing lobbying in some sort of political or government setting, but taking photos and presenting photos and stories can be something that can sort of transcend any needs around formal speaking engagements. So, who can use Photo Voice? I want to go over a couple of ideas and then I'd really love to hear your ideas in the chat. So, these are different groups that could use Photo Voice to study issues or investigate issues or uplift issues of importance to them. So, youth, these are groups I've predominantly worked with when it comes to Photo Voice, seniors, people experiencing homelessness or material deprivation, people with physical and mental disabilities or mental health issues, people with chronic diseases or medical conditions, members of minoritized groups, particularly that want to uplift issues around health inequities and resource inequities, like folks that are racially and ethnically minoritized, people living in rural communities, groups who want to share their efforts and their learnings, like many of you all are on this call today. What other groups or communities might you think of that could use or leverage Photo Voice in their work or to highlight issues of importance? And these could be groups that you work with and serve. Local health departments, excellent. Community health workers, fantastic. That's a really great one too, because community health workers and promotores often already out doing this work at a grassroots level and could really think about how Photo Voice could be part of that work and or change making. CDPH, California home visiting programs, groups with special needs, excellent schools. Yes, right. Kids these days, they definitely know how to take pictures and tell stories, right? Health educators, teachers, wonderful. Any other groups coming to mind? School-based programs, excellent. Something where I've seen this used, this was in some work I did in Chicago. I wasn't there when they did the work, but I worked with several groups in these efforts, and then they've used Photo Voice since, are people who are working in the informal economy, people that may be undocumented, that are working and trying to do different kinds of retail or sales out in the community around food or goods. Photo Voice can really be used to highlight the barriers that people experience to health and being able to get their needs met while also dealing with so many issues around documentation and immigration. Outreach workers, excellent. Okay. So then who can use Photo Voice in terms of organizations? Several of you mentioned organizations in the chat already. So we're definitely on the same page. Schools and organizations that work with youth, group homes, shelters, and other living situations for people who need care. And that's often who I've partnered with in some of this work is community-based organizations who are providing shelter and then working with the youth who are accessing those shelter services. Organizations that work with people whose needs and humanity are ignored, right? This can be an important way to elevate and facilitate people sharing their voices, sharing their stories, sharing their needs and their joys. Community health centers and community-based health providers like local and county health departments. You guys named some of those already. Advocacy organizations or health and human service organizations that include advocacy in their issues and their mission, rather. International aid and refugee organizations. Any other specific orgs that you all are thinking of or that you want to call out that you're a part of that might use or will use Photo Voice in your work? Oral Health Coalition members, yes, exactly. Great. Any others people want to share? And I see a heart. So that's a second right there. Really, anybody. I love that, Andrea. Such a good example or such a good comment. You're so right. Sherry says, using Photo Voice to tell the story of a refugee family, two siblings, one with access to Head Start and one that did not have access to highlight the importance of early prevention. Head Start has a policy that requires all preventative health services, including dental care, are required to remain enrolled in the program. Excellent. What a great example of a really specific way that Photo Voice could be used to highlight different experiences and needs and potential inequities with access to resources. Great. Okay. And then when to use photo voice. I think this is starting to really hopefully come through in all the things I've said so far. Sounds like you guys are definitely on the same page with the things that you're putting in the chat. When can you use it? When we want to change people's opinions. When we think that photography, videos, stories can really be used to do something. When a situation needs to be publicized, right? When we feel like others need to know about what's going on, whether it's a strength and an asset, whether it's a need or an inequity, whether it's a successful program, something that you want to publicize to others who have some sort of stake in the issue. When a community assessment is needed or in progress, so again, this can be a nice part of any kind of, state or government required community health assessment or community health improvement plan. When you need to document the process of or gather data for an evaluation of an intervention or a program. So photo voice can be super nice when thinking about evaluation efforts that some of you may be engaged in your work. When you need to document a site, an event, or a way of life that is marginalized, minoritized, or otherwise threatened. I think that is one of the reasons that we really felt like photo voice was an important method to leverage in work with people who are unhoused and experiencing housing instability and homelessness. And then to drive that big P policy or that little p policy and hold policymakers accountable. Any other ideas about when and or why we could use photo voice? Feel free to share them in the chat. Okay, so please do share if you were thinking, if you were marinating, if you were typing, you haven't hit send yet, please do, and I'll come back to it. And while people are thinking on that, I love this, Andrea, anytime. You are right. You are very right. Um, to promote a program in your community, great. Yeah, I like that. It can just really be that simple, right? It's we want to promote this great thing that we have going on or this resource that exists. People need to know about it. How can photo voice be used to really tell about this great thing? What lessons you have learned or taken away from work or a project? Excellent. Success. Yes, great. Okay, so let's get into a little bit more of those nuts and bolts. So, how do you do this work, right? It is often as simple as using photos, having dialogue, and then sharing the ideas with others. But there are some specific guidelines that are really useful in thinking about photo voice. And I want to say that these are all guidelines. They are not absolute requirements. So the ways in which you all will use this methodology or this approach in your work will depend on your needs, your goals, what resources you may or may not have access to. So take these, as guidance and then use what's going to work for you. So often when we think about photo voice, we really think about it as a participatory, collaborative process from the beginning. And so if we have any partners that we're working with, and partners could be people that are served by the organizations we work with, partners could be people with inside our organization, partners could be people that we want to uplift the voices of and facilitate the stories of, really involving them in the planning process and in the photo voice process early on. So it's not a hey, I'm doing a project and I want you all to take these photos for us on X, Y, and Z. That is going back to that photo elicitation, right? That is not a participatory process. So, photo voice in its kind of intended form is really let's collaborate together to create something, design a program or a project that's going to meet our needs. Participants and staff, and participants can be those partners I was mentioning, and staff, they need training on photography, really simple training, ethics around taking photos and sharing photos, and other trainings around how to make sense of data and how to share recommendations and findings with the public or any intended audiences. But that training can be simple and straightforward. Participants who are working with us in these projects, they need support and they need resources. And that support can be tangible, but that support can also be that social support, that one-on-one or small group support. And a photo voice project, most importantly, should result in some kind of action. Rarely are we doing photo voice just for the sake of doing it. Usually there's some reason. And that action could be sharing the success and helping others learn from your success. That is action. But always we want to think about what is the thing that's going to come out of, or what's the utility or impact of this photo voice project. So this is the basic photo voice process. And again, these are just guidelines. You can kind of really take this information and put things together, mix and match as makes sense to you. So you've got a planning stage, and then you've got these 5 phases. So the planning stage is, why are we doing this project? Who are the stakeholders who should be involved in this, right? Who's going to be involved in the planning? Who's going to be involved in the support of the program, securing resources and or different kinds of support. So for us, when we wanted to do a Photovoice project in partnership with youth experiencing homelessness, we knew we needed some kind of resources and supports to be able to offer those youth that were going to participate with us, or they weren't going to be able to do that. It's not going to be a priority when you've got so many other really challenging things going on in life, like trying to find stable housing. There's got to be some sort of resource or support provided to those people in order for them to be able to and have the intention to be able to engage. Phase one, once you kind of got that purpose, is recruiting and training any partners and participants. And I said to you that it's a participatory process. So that planning and that phase one often are kind of happening in tandem, right? You might be recruiting partners and or participants to work with you in a project and also kind of building the plane as you're flying it, right? So you're recruiting people, but you're also engaging them in the planning process. Phase two is taking/gathering photos and or videos of whatever it is that you're focused on. Phase three is analyzing those photos. And you can use something called the SHOWed method, which I'll tell you about in just a moment, or another approach to analysis. And sometimes analysis is just, let's chat. What do we see here? What does this mean? And how does this help further whatever it is we're trying to do? Identify actions is also part of that analysis. Phase four is to select, process photos and any narratives that go with the photos. And phase five is to have some sort of exhibition of the photos and the narrative. So in classic kind of old school photo voice, there was always this idea of an in-person exhibition with photos on the wall, kind of like you saw in that example from Morehouse School of Medicine a couple of slides back. But nowadays, photo voice can really look different than what we used to think of as the only way to show photos, which is on a wall in some sort of an exhibition space. Photovoice can be used to share findings online, through social media, all kinds of different ways. But in the classic photo voice, you're printing photos and you're inviting people to come see them in person. So let's talk a little bit about these planning phase, this planning phase and this phase one. And so I mentioned that these are kind of iterative phases, even though just for simplicity, I'm kind of breaking them out as 2 different things. So in this planning phase, in this phase one, you're building your team. So who is your team? Maybe your team is you, your colleague, and a couple of people that have participated in a program or an initiative you're working on. Maybe your team is 15 people at your organization or involved in your project, and then stakeholders from different local organizations that are serving the same populations or the same folks that you are. Your team can be really diverse. It might also include volunteers or other people involved in these initiatives. So your team is however you define it for who will be involved in running the project and also who will be involved in taking those photos, sharing those stories. Planning the project, again, a collaborative process. And then this is where we're really getting more into phase one is once we've got our partners or our participants, whoever they are, once we know the rough goal or maybe the specific goal of our project, we need to do some training of our staff and or volunteers and or partners. I'm using a lot of terms here because you get to decide who's involved in your team. So sometimes I'll use the term participants to talk about who I might be recruiting to work with me in Photo Voice. But I often like the term of partners because sure, they may be participants in a typical research sense, but the way I think of it is more these are people I am partnering with to understand an issue, to elevate a need, or highlight a joy. So there needs to be training around ethical photography and any kind of consents for photos or photo releases that you might want. Best practices for photography. People may have heard of the rule of thirds. That is one I learned about as I was learning about Photo Voice, which is just how to set up your photo so that you have kind of the right distribution of the things in the frame so that it looks nice on the page. I have no expertise in photography, but those are a couple of the things that I was like, okay, let me understand these so that I can train my partner in these best practices. Training folks in the structure and the aims of the project. So you, as the people leading or running the project, want to have a sense of the structure so that you can communicate that with the partners or whoever you're you're sharing the work with. And by sharing, I mean sharing the process of the work. And you all can, kind of solidify what you think the structure should be. But I think it's good for whoever is in charge, right? Whoever is the leader of the project process, really kind of saying, this is, we have 2 months to get this done. We have 2 weeks to get this done. We have a budget of $5. We have a budget of $500,000, right? So thinking about what are the things that have to happen? What are the non-negotiables? Often that's time and budget. Overall process for the project, right? So the when, where, and how folks are going to take their photos, they're going to share their photos, right? Are people going to use disposable cameras? Are people using photography, or rather, are they taking photos with their phone and uploading them to some online platform or folder? It's really nice, I think, to have training for those participating in the project in group collaboration strategies. I think we often take for granted how hard it can be to work in groups. And I say we, but you all probably work really hard in a lot of different groups and teams. So you know this. You have not forgotten how hard it can be. But for some people who aren't used to working in groups that often, there may need to be some foundational conversations around what does it mean to collaborate and come together. And then group facilitation, I think we probably all can agree is quite a skill. And so for anybody who's going to be involved in supporting or running the program, like staff or volunteers, they may need some training in how to effectively and ethically and equitably facilitate group discussions, because we don't want this to turn into a top-down situation where the people that are running the project are telling everybody else what to do. It's more, how can we facilitate the conversations so that we are all on the same page about what needs to get done? And that really comes back to this idea of it's participatory, it's collaborative. So then we're moving into phases 2 and 3. This is the fun part, right? All that other stuff, the planning, the training. I mean, some of us might really like that, but probably a lot of you are like, where's the fun part? And that's those phases 2 through 5. So phases 2 and 3, which are often iterative as well, are taking photos and analyzing those photos. So there are a lot of different ways that folks do this through Photovoice approaches. They might have planned/structured outings where groups, maybe the whole team is going out together to some specific locations or some specific places where, your projects are happening. And by projects, I mean sort of what you might be trying to elevate about an intervention, for example. For us, we were trying to think about some of this work across San Diego, where are the places where unhoused youth might access services. And so going out together and taking photos in response to pre-identified prompts and or sort of free form. And this can be individual or group based. So a lot of what I've seen in the literature is people using an individual approach. So you might recruit a group of partners, also could be called participants, who are given cameras. And even if they're kind of co-conceptualizing the idea for the project, it's still, okay, I want you to take 30 pictures in the next 2 weeks on topics A, B, and C. See you in a month. And then there's this approach that we used in some of the work I've done that I've really liked, which is, let's decide as a group what we want to take pictures of, where we want to go, and let's go together. Let's make decisions together of, that's a picture we want to take, or that's something we want to capture via video. And I think even the conversations that are happening as a group when you're out taking those photos is part of the work. So I mentioned that it could be using pre-identified prompts or free form of prompts. So it could be that you as a group or a team decide we want to take pictures of X in response to question Y. Or it could be we want to take pictures of X and it doesn't matter what it is about X, just anything on that topic. So something that might be an example of a pre-identified prompt from a project, and this is from the one about hepatitis A that I was mentioning. This is a prompt we used with our youth collaborators. On an average day, where can someone without stable housing get sanitation and hygiene resources? Now, when we put that prompt, kind of in the language of young folks, they helped us think through this. It was really, on an average day, where can someone go and get clean, right? Where can they get a shower? Where can they wash their face? Where can they get access to some fresh clothes or be able to do their laundry? And that is a big prompt, but really gives you an idea of what kinds of pictures someone might take, right? Where they might go in the different places and spaces they access, and what they might say, I want to take a picture of that. Another example, and I've used this with students on SDSU's campus, what features of campus promote or threaten students' health? just this big prompt. What are sort of the good things for health and the not so good things for health on campus? And students have interpreted that in so many different ways, right? This crosswalk promotes health, or this crosswalk threatens health because the drivers never pay attention to it and they just fly right through. And then a prompt that may be useful to you all as you're thinking about sharing your success stories are, what strategies helped our project be successful in addressing X, Y, and Z, right? What are some of those tangible and intangible strategies that we might be able to capture visually that led to our success? And then the other part of this work, there's the collecting the photos, but then most importantly, I would say, is analyzing the photos. What do the photos mean? What do they represent? Without the analysis, and I'm using air quotes because it's not a formal, fancy academic analysis. It is a, really an analysis that anyone can participate in without advanced training, is what do we see going on in these photos and what do we want people to know about them? So again, you might use something called the SHOWed method. So what is the SHOWed method or the SHOWed analysis technique? This is something that I do not believe Wang and Burris, when they originally developed Photonovella, aka Photovoice in the early 90s and 80s, came up with. This is something that folks kind of identified and developed later on to help with analyzing the photos. And this is something I have used in my work, and I absolutely love this approach. So SHOWed is an acronym for these questions that you and your partners can use to make sense of the photos or the videos that you take. So what do we see here? Literally, what is on the surface of this picture? What am I looking at? I'm looking at a picture of X. The next question is the H in SHOWed. What is really happening here? And so that's kind of digging, having us dig for what is going on under the surface. What does this mean, right? The O is, how does this relate to our lives? What does this mean for our lives? And that might be the health implications, that might be the long-term implications around sustainability of a program. The W and the E is, why does this situation, strength, or concern exist? So this is really getting, if we understand the why, then maybe we can address that why if needed. I recently learned of a new E. So you could also include this question if you like, is how can we become empowered through our new understanding of this issue? And then the D, the most important, is what can we do about it? Meaning, if there's a problem that we're seeing, how can we address that problem? And for you all who are thinking of how you can use Photo Voice to highlight successes, the what can we do about it might be, what can we do to sustain this work? What can we do to help others understand how to use the same successful processes we used so that they can have successes as well? So you can really interpret these and modify these to work for your project. So then the last phases of Photo Voice are that exhibition. And again, we might be thinking of a formal kind of quote unquote old school exhibition. And I guess I'm old school because I still like an in-person activity, but this could also be something that's happening virtually online, which is choosing the best photos and narratives that are going to meet our project goals and our target audiences. So in the project I'm about to highlight for you really quickly, we collected almost 300 photos. We are not publishing 300 photos. So which of the 300 we took, what are the 30 perhaps that we think are the most impactful and useful? You're often creating captions for those photos and then edit and refine any narratives that go with those photos. And so those narratives might be that SHOWed analysis in sort of a written form, processing those photos, whether it's printing them or prepping them for online, and then hosting that exhibition. And I would say that the exhibition, the ways in which you share the work, shouldn't necessarily just be passive, and that people are meant to look at it and take it in. That can be useful. But how can it also be used to generate discussion, generate dialogue, facilitate connection? So I want to highlight for you two projects. I mentioned that I want to talk to you about one that I conducted around the Hep A outbreak, and then show you another that I wasn't involved in, but I'm aware of. So we'll call this Photo Voice in Motion. So this is the Action for Health study, which was a youth-driven photo voice study to examine the roots of San Diego's hepatitis A outbreak. So as I mentioned at the beginning, this was about 2017. There was a major health outbreak that I believe started in San Diego, quickly spread to other places in California. Some of you may have experienced this, been affected by this outbreak through your work, and then eventually hit more than 30 other cities and jurisdictions across the United States. So this is a little bit of background of this outbreak in San Diego. And let me just keep a little eye on the chat in case there's anything. Alexis remembers this during undergrad. Yeah, it was a rough time. I was just moving to San Diego from Chicago at the time, Atlanta to Chicago, then to San Diego. And I remember it was like, okay, I'm here and there's a public health emergency. How can we get involved? And so San Diego, many of you probably know this, whether you live in San Diego or in other parts of California, consistently has the fourth to fifth highest rate of homelessness in the US. We are truly experiencing a housing crisis in the city. And I know many of you in other cities in California are experiencing a similar crisis. And the roots of that are housing, is the housing market, is the immense cost of housing, and the reasons why people may not have access to housing, like inadequate pay, lack of jobs and job stability. There are also mental health factors as well. But really, the root of this problem is the soaring cost of housing. So I always want to just say that that's at the absolute root. So we had this unprecedented hepatitis A outbreak beginning in 2016 and lasting through 2018 that disproportionately affected people experiencing homelessness. And so often this was tied to a lack of inadequate sanitation and related resources for folks when they don't have anywhere to stay at night, when they don't have anywhere to use the bathroom or get their clothes cleaned or be able to clean themselves through a shower, for example. Things like infectious diseases can particularly be something that can affect them. And hepatitis A was certainly that issue. And so, again, the outbreaks started in San Diego, or at least one of them started in San Diego, and then quickly spread across California and the US. And so public health did what public health does. They jumped into action, people on the ground, putting hand washing stations in because we knew that a big part of the outbreak was that lack of sanitation for people without housing, putting in porta potties, power washing streets, and distributing vaccines. Important and good work. What my colleague and I began to think about as we were understanding kind of this outbreak, why it was happening and who it was affecting, and talking with different people working in organizations serving these populations, is that some of the interventions, although they were important interventions, there was also some blame placed on people who are unhoused and experiencing housing instability and homelessness as sort of the reason for the outbreak. Yet, interestingly, even though they were disproportionately impacted, people with stable housing also were impacted by this outbreak. So there was a sense of this group is being blamed for a larger public health issue. We felt as though there was little discussion of the root causes or long-term solutions to the outbreak. It was a how can we address what's going on now? But what happens when the outbreak ends? Are we going to do something about homelessness and lack of sanitation resources? We were seeing very little conversation there. And then, most importantly, is we felt like there was a minimal inclusion of the voices of those who are directly affected in conversations around the outbreak, particularly youth who didn't have homes. So we brought together a team. We later called ourselves the Action for Health team for the Action for Health study of my colleague, Gerald Calzo, and I, who's in the middle in the striped shirt. We brought a team of students together that were really passionate, public health undergrads and grad students, really passionate about issues of homelessness and housing instability. And then we recruited youth experiencing homelessness and housing instability through partnerships with local organizations. And we kind of confirmed with our youth partners, is this an issue? Should we do something about it? The responses were a resounding yes, yes, and yes. And then, okay, let's collaboratively carry out this study. So these are the guiding questions for our study. And I share these with you so you can think about kind of the guiding questions for your own Photovoice projects and work. So our questions were, how did youth experience the outbreak and those interventions I mentioned? What were the social determinants of the outbreak? And how can policymakers and public health professionals respond differently to outbreaks in the future, maybe in ways that are immediately responsive to the outbreak, but also to address those root causes and long-term outcomes? So again, my colleague and I at SDSU, 4 youth research partners, and then more than 4 students, because we had students graduate and come in, sort of throughout the length of the project. And our youth partners were engaged in all study processes. Although we came up with the initial idea, once we recruited those youth partners, we validated the ideas with them and the need, and then co-designed the project. So we used a couple of methods in this project. The primary method was Photovoice. We felt like Photovoice was great for this topic because we knew it would be approachable and accessible to our youth collaborators. We also felt like it could be used to really highlight these inequities that were happening in the physical space around us. So photo voice is great when you want to document something you can actually see. We also embedded within that process something called go along interviews, where while we were taking photos or collaboratively taking videos, also doing some structured conversations and interviews with our youth partners, so that they could even more describe what they were experiencing and what they were going through during this outbreak. And then we included some other methods like stakeholder interviews, mapping resources and county interventions like hand washing stations, and member checking / member reflections, which meant going to other youth having the similar experiences and saying, this is what we're learning so far. Are we on the right track? Here are some of the ideas we're coming up with. What do you think of those ideas? So really getting that feedback from people with lived experience of homelessness, even if they weren't the primary partners in the study. And this is kind of the life cycle of the process. We had this idea, and then we clarified that issue with TAY, that's transitional age youth, meaning youth 18 to 24. We then collaboratively said, what is the question we're trying to answer? We selected our methods, Photovoice and some of those other approaches. We collected our data and analyzed our data. We member checked those findings with other people with lived experience, and we sort of went back and forth. We'd collect data, analyze it, bring it to other folks and say, are we on the right track? And they might say, you are, but don't forget to capture X. And we say, okay, back to more photos, back to more analysis. And we did that in several rounds so that we really were understanding what we needed to know and maybe what we were missing. And then most importantly, because it's photo voice, sharing those findings and making recommendations for action. And so our photo voice kind of looked like this at a more granular level is collecting those photos. And we had more than 250, nearly 300 photos that we took across maybe 10 group outings across San Diego. Sometimes we had very specific prompts, that one I mentioned earlier of, where can a young person get access to sanitation resources, meaning where can a young person get a shower? Where can a young person get some clean clothes? And sometimes we were like, let's just go walk and see what speaks to us around this topic. Then we would come together as a group and use the showed method to analyze selected photos. So we might have 40 photos from a 1 hour outing together. And then we might, as a group, say, of these 40, we want to analyze these four. These four we think are the ones that really stand out. So let's do the showed analysis with these 4 photos. Member check those findings, gather additional data. And then we held this forum of about 100 stakeholders at the end of the project. So a couple of things that came out of this project, so you can kind of see what it looks like, is we had a couple of themes. So theme one is that we found collaboratively that bathroom inaccess, so a lack of bathroom access, was an important social determinant of health of the outbreak. Interestingly, a lot of other researchers found this too, and we weren't working together, and that work hadn't been published yet. So our process allowed us to kind of find a similar theme that other people found, but we collected it through photo voice, so kind of had a different angle. And this is a photo that one of our youth collaborators said, we got to take a picture of that photo. So we were near the train station. I think we had gone inside maybe to try and use the restroom or see what the restrooms look like, because we knew we were interested in restroom access. And we saw this sign, private restrooms, Amtrak customers only. And one of the youth collaborators said in part of our analysis of this picture, being clean, it doesn't sound like a basic human right, but I feel like it is. You know what I mean? Being able to be sanitary and be clean. And for clean, that meant to them being able to use a restroom when you needed it, being able to wash your hands after. And so such something that they thought of as a basic human right and public health need is something they could only access if they have the funds to be able to be an Amtrak customer. That led us to several solutions. For example, framing bathroom access as a basic human right, increasing the number of clean and safe bathrooms across the county. This is an ongoing challenge. I could have a whole nother talk on that. And then countering something called NIMBY, which is not in my backyard attitude. So this idea that people say, well, sure, people who are unhoused should have access to resources, but I don't want that in my neighborhood. Because what really this helped our team think about is, how does this problem affect all of us, not just those who don't have housing? Another theme that came up out of this work is that the youth felt, and we did too through our analysis, is interventions did not address the root causes. And often our youth collaborators really saw the interventions as a performative. So here is a picture of one of the hand washing stations that was put out by the county health department or the city health department. There was a lot of kind of back and forth on county and city, as I'm sure we've all experienced before. And this was meant to help people wash their hands to avoid transmitting hepatitis A. But you can see that it was not being used for that purpose. It was being used for people to wash clothes and dry clothes. And I think what this picture was really important for us to highlight is not that people are misusing hand washing stations, but more that people have access to so little sanitation resources that this is one of the only things they could use to even wash clothes. So this intervention, while important, people need to wash hands, it is nowhere near enough what people need to be able to be clean and healthy. And so one of our youth collaborators said this during an analysis session, excuse me, it's not helping, meaning these interventions, it's just a band-aid on something that no one really wants to see or acknowledge. Another photo that we took during one of our outings is a hand washing station that had no water and no soap. Again, our collaborators really saw this as ineffective and almost performative because in a lot of our conversations with different public health officials, they said, we've got this under control. There is no need to worry. There are hand washing stations everywhere. And these simple pictures really helped us say they might be there, but are they being serviced? Are they usable? One more picture that I'll highlight for you. This was a picture we took of people that were power washing the streets. They're just doing their job. They're not doing anything wrong. But the way that our collaborators really saw this is they're washing the street by where they, as they said it, the business people go to take the train, whereas maybe people who are in town for a short time go to get access to transportation. And so one of our partners said, let's give them hand washing stations, power wash the streets, and then send the police to clean it up. That is what the mayor did. So our partners were really savvy in thinking about what are the ways in which government officials might be addressing the outbreak, but not fully addressing it from a true public health perspective. So just in the interest of time, I'm going to show you this last photo from our project, and then I want to keep us moving because by 11:05 it's time for Q&A, and I'm really looking forward to your questions. These are some pictures we took within a youth housing program that our youth collaborators had used. I'd been a volunteer there for a long time. We had permission to take these photos. We did not just go in and take them without permission. And so these are some of the beds that were set up in that shelter that has since been closed by the city. Not because it wasn't good, but something around permitting apparently. And then you can see this station where people are charging their phones. And so there's that, pretty intense thing for some of our collaborators to say during our analysis session is the shelter's a pro and con, right? You get a shower, food, clothing, but you only get it for a short time. And then this is really where the more controversial take, but an important one is you have to be a dog and pony show to access resources. And so our youth collaborators were really highlighting how you kind of have to share all the bad things you've been through, all the things you're going through to kind of convince people to be able to let you into a shelter, for example. So we held this community forum to really share our findings, generate feedback, and ideas for action. We wanted this project to have impact. We knew we couldn't even get so far as really creating change without getting the conversation going. So we worked our tails off to invite people from government agencies, local public health, different branches of public policy, service providers, young adults, academics to come to this forum. We had 30 minutes of an exhibition and photos where people kind of walked around the room and looked at the photos and the narrative and had time to take it in and sort of mingle, get to know each other a little bit. We had a 1 hour presentation of our key findings and our recommendations and discussion, really engaging in critical dialogue about what we were seeing there. And then we had 30 minutes more of this networking. It seems odd to use the term mingling in such an, kind of a serious context, but it was a chance to say, hey, you're working on this issue too, let's connect. And we also invited partners working on similar issues to share some of their work as well. So we used it as an opportunity to highlight our work, but also to highlight complementary work around youth homelessness in the city. We invited press. We were really excited that somebody from San Diego Tribune came and talked to us and highlighted it in the project, highlighted in the paper. And most importantly, we had food. You cannot have an event without food, right? So we wanted people to feel like we really valued their time and wanted them well fed. And these are some pictures from that event. One more thing that I want to highlight for you all, and this is again something I was not involved in, but I've used as a teaching aid in some of my classes where I'm teaching students about Photovoice, is called the Asthma Mitigation Project, Stories from the Field. And so this is a project that really used different kinds of Photovoice approaches to highlight work that's being done around asthma mitigation. This is how the program is described: a collaboration of 28 funded partner organizations provide culturally and linguistically appropriate home-based asthma remediation services to Medi-Cal pops with disproportionately high rates of asthma across California. They used Photovoice to highlight how the project had supported people with asthma. The project included reflections from home visitors and program participants from 10 funded partner agencies. And this is one that may be useful for you all to look up and kind of see how they did things, because it may be in line with your charge and your goal of sharing your success stories. So these are some of the examples from the online information about it. You can see different programs across the city that they're highlighting, those in San Joaquin County, San Diego, Sacramento, Sutter County. And then one that I thought was a particularly powerful one, and again, I encourage you to go and sort of look at these, was the Little Manila Rising Project. This is an organization that serves youth, and I just happen to be familiar with. These are some pictures that their partners or their participants took, and some of those quotes that went along with it. For example, this one on the right is, "This medical clinic in South Stockton sits under a bustling freeway and sits next to the port of Stockton. This image captures a stark contrast between a place meant for healing and the catalyst that releases harmful toxins for anyone to breathe in." And so that is a quote from somebody who's an advocate for the program. And perhaps this is a picture that you might use alongside of pictures or photos that show the actual program and intervention that's being worked on, to kind of highlight this is the challenge, but these are some of the ways in which our program has had success in addressing those challenges. So very quickly, before we move to Q&A, I want to give a couple of examples and recommendations for Photovoice process, and then some great resources that I've used in my own work. So planning your project, consider the following questions. And I know you all are going to get the slides after, so don't feel like you got to write all this down quickly or that we have to get through it all. But these are the things you might want to consider for you all in particular. What are some of the successes you want to highlight through Photovoice, right? It's not just challenges, it's joys, it's success. How would you, or who rather, would you invite to be your quote participants or your partner in your project? Are those the people that were working on the programs and the interventions? Are they the people served through those program and interventions? Are they other stakeholders around this work? How would you find and engage those people or those groups? What are some prompts or strategies that you might use to guide the photography and analysis? It's really helpful to think about what are the prompts I would share or come up with so that partners knew what to take pictures of or knew what kinds of things they want to capture visually. What impact do you want your project to have? For us, with the Action for Health study, we didn't fully know the impact until we kind of got through the project, but we knew that there was something we felt like was an unjust situation that required and deserved attention. And so I think, if anything, we just wanted the impact to be people should be aware that these are voices that aren't being heard and these are issues that aren't being elevated. And then the broader impacts kind of became clear to us over time. How much time do you have, right? Again, maybe you've got 2 weeks and $200. Maybe you've got 2 years and a really large grant to get this work done. So those are things you got to know, because they're going to help you think about how this project is going to go for you and what are resources that might be funding, but that also may be intangible human social resources that could go into supporting the project. These are those phases, just showing those to you again. This comes directly from something called the Facilitator's Toolkit for Photovoice Project. If you Google it, it will come up. This was the number one thing I used to run that Action for Health study. It's wonderful. It's got example consent forms. It's got information around how to train your partners and your participants in photography, how to train people in ethics and group facilitation. I absolutely love this resource. I highly encourage you to look it up. It's been around for many years and I haven't seen anything better yet. This comes directly from that facilitator toolkit, and it is a 14-week project with kind of one analysis phase. So in Action for Health, I told you that we did an iterative collect data, analyze it, member check. Collect data, analyze it, member check. This is a little more of a kind of linear process, which may be what works for you in your project. So they've got these first 5 weeks of really planning and introducing partners to Photovoice. Taking those photos, they conducted over a 2 week, or they recommend a 2 week span. Again, we did it over a lot longer, but our process was very iterative. Just 1 week of analysis. It really depends how many photos you're working with. We're talking 100 photos and we want to analyze 20. That's very different than 300 photos and we want to analyze 100. So think about your goals and needs. several weeks to process those photos. This is especially important in the days in which there wasn't the digital tools we have now. So, with some savvy team members, you could probably process, quote unquote, those photos for online in 2 hours, right? So it kind of depends on what your modalities are. And then having a community exhibition. This is the process that we used. Now, we did not do it in 6 sessions. We did it in probably 20, 30 sessions. It was a long project, but we had tools and resources for that. And I've highlighted in each session what's different. So in session one, you could conceptualize, we always want an icebreaker, something to get people comfortable discussing project goals. These could be pre-planned or they could be determined at that meeting. Creating community agreements, what does everybody want to get out of this? What are we all putting into it? And then photography and ethics training. You could then at the next one, icebreaker, revisit those agreements, continue that work around photography and ethics, and then really determine what's our strategy for the photography. Where are we going? What are we taking pictures of? Who's taking pictures? And even go out and start taking photos in that same session, right? If you have a 2 hour block, maybe you're planning and training for an hour, and another hour is literally out in the field taking photos. We've got 3 through 4. You're continuing to take photos and do that showed analysis each time. This is that iterative process. And then in sessions 5 through 6, planning for what are the actions, what are the solutions we want to see from this? What kinds of ways do we want to show this, right? Through a physical exhibition, for example. And if so, who's involved? Who's going to be there? Who's processing the photos? And then maybe at a final session, really finalizing those solutions, priorities, finalizing those plans for the exhibition. Some of the things that you may need in a Photovoice session, you could probably come up with all of these. I'm sure y'all do all kinds of trainings and events. These are just kind of my brainstorm. We always want something we can write on a whiteboard, a large post-it note. If we're online, maybe that's a virtual platform for writing, training slides and handouts. Kind of depends on who your partners are. Some people may be okay with only virtual materials. Some people really might want those things they can hold on to and keep as they work through the project. Any sort of consent forms and photo releases that are going to be used in the project, cameras and batteries. If you're using traditional cameras, we used phones in our project and we got permission from our university's IRB to be able to do that. Always got to feed people, incentives and receipt for incentives if you're incentivizing your partners. Again, we did. And for those analysis sessions, something that we did is we had showed handouts. So I took you through that. What do we see here? What is really happening here? All those showed prompts, and we would have a printout and we'd have each question sort of staggered throughout the page so people could free write their answers. And then we'd go around our circle and kind of say, well, I said this about this picture. I said that. And that would be what really drove the dialogue and the discussion. You may, with permission from your partners, record those discussions or have a note taker. And then last but not least, these are some of those publicly available resources that I suggest. Again, if you Google any of these, they'll pop right up. But when you get to slides, I've also linked for you there. My favorite, that Facilitator's Toolkit. There's a great manual and photo toolkit from NACCHO. Another I really like is Implementing Photovoice in Your Community. That's through University of Kentucky. And then some ones that I found more recently is something called the SELP Toolkit and an Arts and Planning Toolkit. So my final word of encouragement is you got this. I'm self-taught. If I can do it, I know you can do it. So thanks for letting me go over a couple of minutes, and I'd love to do some Q&A with you.
Amazing. Thank you so much, Jen, for that crash course in photo voice. I don't know how many of you have ever done a photo voice project. I certainly have not, so this was enlightening for me as well. And now we have some time for questions, and there have been some that have come in the chat that are really questions about consent and ethics, especially when your audience or the group that you're working with are children or schools. And so there's a couple of comments. I'll just read Bonnie's. She wanted to ask about consent photo releases. It's probably easier to get when it's highlighting successes, but more difficult when it's to show the problems or issues. So do you have any suggestions to make sure we are getting the necessary permissions and or how to work through permissions challenges?
That is a great question. It's something that in that Action for Health study we really grappled with. And the quick answer is you want to have those consents from anyone that you're going to take a picture of anything that's identifiable, right? So a picture of someone's face, of their home, of something around their activity space. You got to get consent. And if you can't get consent, you can't take the photo. And I think it's as simple as that. And unfortunately, and sometimes it may be that it's a conversation with someone um, around what is it that we're trying to highlight, and maybe even reframing what are we trying to do as a team, and what photos can help us capture that, and who might want to help elevate that by allowing that photo to be taken. And then, as I mentioned in that toolkit, they have some like already ready to go consent forms and photo releases that are great. In the Action for Health study, we decided it was such a sensitive topic and it was really a public health issue. It was not an individual issue that we decided to not take pictures of anything identifiable. We decided that everything we would take pictures of would be something that anybody could walk down the street and see, and you would never know who the actual individuals involved were other than those on the project. And so we didn't need releases. That hand washing station, there's no hand washing station to say, can you sign this release, right? But it still told a really important story. When we took pictures of any like resources, again, we made sure not to highlight the exact resource because we would have need permission from them. But we might say this is what a shower looks like in a public setting. So that was something we did that you could consider. You all have probably such different kinds of projects. You'd have to think through, what you need to capture. But that is one way to get around concerns of consent is really just highlighting public information. And then we did have consent from our partners, our youth collaborators, to say, can we collaboratively, them included, share your stories and the things that you shared as part of any reports or analysis that we put forward. So we never wanted to use someone's words without their permission. I hope that answers the question, and I'd be thrilled to really engage in more depth with anybody about this too. So when I say reach out to me, I really mean it. Please reach out. I'm happy to chat one-on-one too.
Great, thank you. And Celia is put in the chat an actual photo that they use, which is a photo from a classroom
Cool.
presentation. So students taken from the back, so that's not as identifiable.
And that is something that would go into an ethics training and conversation at the beginning of the program. And for that Action for Health study, I'll say we went into it thinking we would want people's faces and need photo releases and consents. And our youth partners were like, we shouldn't do that. And here's an alternative. So our partners really helped us, guided us in that.
Yeah. Thanks for the example, Celia. Did anyone else have any follow-up questions about that? I know COA success stories is a big part of your work plan, and so wanted to make sure that we're answering any questions about consents or ethics of using this method. And if not, any other questions for Jen about the method, about how you might use it in the work that you're doing? Lynn's
I see.
asking, are the consents written or verbal?
I think I think the short answer is that would be a project. That'd be a project decision. I think that, if this is research and you have an institutional review board who is concerned with this, there's one answer. There's got to be approved consent through the institutional review board. If this is public health practice that is not considered research, which I think a lot of what you all are talking about, whether it's assessment, evaluation, sharing success stories, you get to make the rules based on what you think is ethical and appropriate. So, it may not be feasible to get written consent always. There could be all kinds of reasons that written consent might not be appropriate, and maybe verbal consent is okay. But I think that would be you all decide as a team and with any sort of administrators who might be involved, what is required and expected. But I would think that in some cases, verbal consent could be acceptable.
Thank you.
Fair. Great
Okay.
point, Jennifer.
Mm-hmm. And Iris is saying that at health fair events, typically post signage stating that there's photos and videos is another way to go about it.
It's great.
Okay. I'm wondering if you all have questions about how to apply this to your work plan, or if you've already done it, if you could share examples of how you've done this. You can raise your hand and you can unmute and we can talk. You don't have to put it in chat. Monica.
Hi, Aubrey. Hi, Jen. Thank you so much for your presentation. That was really informative and exciting. Um, I just had a question about, so I was wondering if what I'm thinking of, I put this in the chat earlier, if it might be applicable for this type of project. So I've been working with my local FQHC and my managed care plan partners within my coalition to create a video around promoting their strategy for implementing application of fluoride varnish for children during well child visits. And they've had a lot of success around this, and they're integrating this into their FQHC setting. We want to share that success through this video, kind of talk through with them their strategies and best practices and all of that sort of thing. I went out and filmed it, and the intention is to share it with other medical providers and offer a fluoride varnish training. And so that's what I've done so far, but I was just curious if that kind of fit into the photo voice project or not.
That is a great question, and I think a really good example. And I think the short answer is yes, sure. You're using a lot of the approaches in that are from Photo Voice. I think there could be, and again, this is where I say it's like there's guidelines, and then there's like use this to get your needs met, right? Whatever you're trying to accomplish. I think that maybe part of what you could consider adding to kind of have an additional flavor of Photo Voice. I'm just brainstorming here. I definitely don't have all the answers. Is there some testimonials or narratives or almost like quote unquote analysis you could do with some of those providers that you're highlighting in that video, in that documentary, right? Like maybe it's even unpacking with a couple of these stakeholders, why is this program working? What is working about it? How is it different from, maybe other programs? Not that we're necessarily comparing, but how is it elevating something? And how can other people use this program in their work? So if you don't have those testimonials or that conversation already, that could be something that you could add. Another thing that you could do, and again, maybe you're doing this already, if feasible, is kind of even working through that video that you're taking with some of those providers and those stakeholders and getting their feedback. Is this telling the story that you want to highlight as somebody who's been participating in this program? What do you think people should know? So you can kind of have that iterative conversation and quote unquote analysis as a way to kind of further it as participatory. Those are just some ideas, but it sounds like you're definitely really leveraging photos to elevate a success, really facilitate that voice of the people participating. So I think it definitely sounds like photo voice. Hope that's helpful.
Those are great suggestions. Thank you so much.
You're so welcome.
Jennifer, go ahead.
This question is more for you, Aubrey. Just looking at the schedule and what's due, just wanted to clarify. I know it's due June 30th, but is it just the plan that is due, or is it actually the whole project that needs to be already finished?
Right. I think this is more a question actually for Office of Oral Health that they can clarify, but the way I read it, it's the dissemination plan is due then. Um, but I'm happy to be wrong about that if necessary from Office of Oral Health, if anyone, any of the PCs or Paula is on the line and could clarify. That's what I read in Appendix 14, is that the
Okay.
dissemination plan is due then.
Okay. And is Photo Voice the only tool that we have available, or is it just open to what is the plan for us to share our successes? And Photo Voice
Hmm.
is just one option.
That's right. It's just one example of a method that you can use. Yeah.
Okay. Thank you.
Are there any other questions from anyone here for Jen about how you might use this method? Any questions about the projects that she shared or the examples?
I have another question for the presenter, Jennifer.
Please.
Um, are her projects that she presented, is there a website where we can see the whole campaign or posted, or how is that how is your Photovoice project available to be able to be viewed?
That is a great question. So the second project that I highlighted about asthma mitigation, the one that I wasn't involved in, that one is definitely online. I've linked you to it in the slides, but if you Google, California asthma mitigation and Photovoice, it'll pop right up. Actually, not a lot of examples of success stories via Photovoice. I really have thought about this over the years, and it's just, sort of kismet that I'm doing this webinar with you all too. And I was trying to find more examples and I really couldn't. So that doesn't mean they don't exist, just means they might not be publicly available. So anyway, hopefully you all are going to add to that body of evidence. Ours, I gotta say, as an academic, we're not the best at highlighting our work publicly. We have a community report that I'll try to find really quick. And oh yes, thank you. That Little Manila Rising is definitely the example that I thought was so good. Thank you, Iris. For the Action for Health project, we had a community report. I believe it's available on my lab's website. So I'll see if I can just grab it real quick and drop it in the chat. We also had an academic article come out of it. That's not that useful for public policy change. But there's not like a specific website. We did use Instagram to really share some of the photos and like hype up the project, but it hasn't been updated in years. So the short answer is yes, but that is not something we were great at. So thank you for that great question. I'm going to try to find the report real quick, though, while we wait on any other questions.
Hi, this is Paula. I hope you guys could hear me. Just the dissemination plan is due June 30th. I don't know if there was another, Jennifer. Did you have a follow-up question? I was trying to track it, but was there another follow-up question to that?
I think that was it. They were just curious in what was actually due on June 30th, and it's the dissemination plan.
Yep.
So that the
Not the
entire
final.
success stories doesn't have to be complete by then.
Right. And there's
Awesome.
multiple ways to share success stories. I think that was some of the follow-up. This is just one sample. So I think that was also said. So I want to confirm that as well.
Yeah. Thank you so much, Paula. All right. If anyone else has questions for Jen, please go ahead and drop them in the chat. I'm going to start running through some announcements that we have and continue on the slides, but I want to make sure that your questions are answered too. So please engage in dialogue in the chat as we run through the rest of today's presentation. Okay, so here's a big one that's sort of hot off the presses. We received some guidance from CDE and Office of Oral Health just yesterday about how to implement AB 2630, which went into effect on January 1st of this year. And that is adding TK to COA. And so here are some of the top 3 things that I read from that guidance that I want to share with you. And more will be coming on this. I just wanted to make sure that you all got this as soon as possible. So I just wanted to make sure that what this bill does is that it's saying that proof of a COA assessment is required only once during the 2-year TK and K timeframe. So only one time is required. In SCORE, you are going to be counting TK with K. So you're not reporting them separately. And then on the COA form, which you can see on the right there, there's a little grade field. You'll just indicate the grade level there on the COA form, whether that's TKK or first. So these are the high level, guidance coming from Office of Oral Health, and more will be coming out soon. I just wanted to make sure that this was on your radars as soon as possible. I'm going to go ahead and move forward, but if you have questions about this, drop them in the chat. I see Paula is active and on, video on, ready to answer any questions. Other news in COA, we have newly translated forms. So you can find them on our website. They've been translated into 6 languages. You can see them on the left there: Spanish, Mandarin, both simplified and traditional, Korean, Tagalog, and Vietnamese. Gustavo put the link in the chat where you can find them. You can navigate from our site to find them there, and they're all linked right above each of the different forms. So this is great news and something that's been in the works for a few years, so we're thrilled to be able to share them with you. We've also updated our website, COHTAC website. So we've updated the resource center on the left, as you can see, and our past events. They're all been tagged by your work plan objectives 1 through 7. So you can go into the resource now. It's all been updated. This is a long undertaking, but they're now updated to the current work plan's objective numbers. So that is a great update, I think, to our own website. and should be active. We are still going through past events and tagging them, so that'll more to come on that, but we're working through them as quickly as we can. And then we're also recruiting for two of our group TA programs. So school open hours, we're recruiting for two cohorts, one that's going to start actually next week and another that'll start in April. Small group learnings to facilitate implementation of your school dental programs. There should be a link in the chat to fill out a little survey, or you could also scan the QR code to tell us if you're interested in joining. This is facilitated by Bahar Amanzadeh, among others, and our team, and we would love to have you join us. And similarly, RBA Learning Collaborative, so results-based accountability. This is another small group learning collaborative that we offer, and we're hosting a new cohort in February or March. There should be another link being dropped in the chat now about how to sign up for those. If you're interested in learning more, you can head to the website link or take that survey to join our next cohort. And then lastly, next month starts National Children's Mental Health Month, and we have some resources on our site that have been sent out. Children Now came out with a new guide that's posted on our site too, and Gustavo's putting all those links in the chat. We'll also email these out to all of you, so don't fret about you grabbing all the links right away. We'll send them to you afterwards. But we have tons of resources to help you with that. And actually, Smile California has some new resources too. And I'd like to invite Maria or Lauren on the Smile California team to run through some of those.
Perfect. Thank you, Aubrey. All right, there you go. Hello, everyone. We'll be quick here. I know we only have a few minutes left, but good morning, and thank you so much for giving us the opportunity to speak with you today. I recognize some names here from yesterday's Smile California National Children's Dental Health Month webinar, so hello again. And for those who could not join us, I just wanted to briefly introduce who Smile California is. Smile California is an awareness campaign under the Medi-Cal Dental Program with DHCS that's focused on educating and empowering Medi-Cal members about the importance of oral health and, most importantly, the many benefits available to them through the program. For National Children's Dental Health Month, Smile California invites all of you to go with us on an exciting journey to make dental visits more fun, educational, and empowering. As you can see, we've created this healthy smile land where we want to take families through Checkup Canyon, Sealant Island, Fluoride Falls, and many other places around Healthy Smile Land. We can go to the next slide, Aubrey. Thank you. So yeah, we're excited to just share with you a little bit of everything that we've created for your organizations to use. And we do want to apologize in advance. These materials aren't available on smilecalifornia.org just yet. However, we're working very hard with the state to make sure that they're going to be ready for you to access by next week and just in time to kick things off for February 1st. Some of the materials that we created are 6 new social media images. These are single posts, and we also have a carousel post for those that you like to post carousels, and they're going to be available in English, Spanish, and Farsi, along with some suggested captions. We've created a new coloring sheet as well to engage the younger children, new stickers, and have also redesigned our covered service flyer we made it a little bit more simplified and visually engaging to make it easier for families to understand what's available to them. Along with these new materials that we've created here on screen with some email signatures and banners for you to use, we also have our materials like the K through 5th Children's Dental Health Packet, dental sealant materials, and fluoride varnish. And before I kick it off to Lauren, just want to remind everyone that everything that you see here on screen is available for you to co-brand. And this means that we can add your organization's logo to the materials to make it more customized for your outreach efforts. This service is completely free for all local health departments, LOHP, state agencies, nonprofits. You can simply just send us an email to hello@smilecalifornia.org that I'll be dropping in the chat here, if that's okay. So now we can go over to the next slide. Thank you.
Thanks, Maria. I'll be really, really brief too, but nice to see some of you folks again, and hi to everyone else. So in addition for this year's promotion for National Children's Dental Health Month, we're also offering NCDHM event kits. So you can bring Healthy Smile Land to your community by requesting this free kit. They're designed to enhance your local events and help families learn about medical benefits in a really fun and engaging way. So as you can see on screen, these kits include the Healthy Smile Land coloring activities, stickers, and then some toothbrushes that some of those images were focused or showcased on the previous slide. So you can request your kit by scanning this QR code, and then we'll also drop the link in the chat here in addition to the co-branding form that Maria's dropping the link for. So either scan or follow that link. Once we receive your request, we'll send your kit right over to you. And then just one last slide here, if you could go to the next one. These are our landing pages for NCDHM. As Maria mentioned, our resources will be up there shortly. So feel free to scan those QR codes, or the URLs are on the screen. I also dropped them in the chat. And be sure to follow us on social media so you can see Healthy Smile Land come to life. And as always, you can reach out to us at hello@smilecalifornia.org if you need any assistance, have any questions. But we're looking forward to helping you all and supporting you during next month. So thanks again for your time.
Thank you guys. This is excellent. Thank you very much. And that's all we have for today. So just on time. Thank you for being here. I'm going to go ahead and stop sharing. I see there's a lot of chatter in the chat box. So I'm going to make sure that we capture all of those and get your questions answered. But in the meantime, I am going to, here it is, launch our evaluation poll, which is just a short 4 questions that should be popping up on your screen. And Gustavo, if you can put the link, thank you, to the Qualtrics form there, where you can give us any of your comments about today. But I want to share a huge thank you to Jen for joining us and sharing her experiences with us, giving us a crash course in how to do Photovoice. Thank you all for being here and for your rich engagement. We are always pleased to see you. And we'll stay on for a little bit longer, but hope you have a wonderful rest of your day, and we'll see you next time.
Thank you.
Thank you all.
I do want to respond to Nicole's. If Nicole's still on here, she said, would you please clarify if the new Spanish call form is the same as one that was previously online for San Mateo? It is slightly different. This one's the official one that Office of Oral Health sent out. So please use the one that's on COHTAC. We just use San Mateo's in the interim.
Okay, thank you. I just sent that
you're
to
welcome.
some of our partners for the Give Kids a Smile event. So I was like, oh, maybe I need to resend it. So that's really helpful.
It's fine. If you already sent it, that's fine. Just
Okay.
moving forward. Yeah, it's as long as this, and we vetted it, the San Mateo one, COHTAC vetted it, and so it's fine if you use that one, but use the new one going
Okay.
forward for next school year.
Perfect. Thank you so much.
Yeah, you're welcome.
Bye.
Paula, this is Jennifer from Santa Barbara. I have a question regarding COHA.
Yep.
We have schools that are pushing back that they say that they are not mandated to do the COHA form. And these are the, I'm blanking out on the name of the schools. They're not the regular public schools, charter schools.
Charter schools. Charter schools are public schools, unless they're private charters. So so what is it? Do you know if it's part of the school district or that if it's a public funded?
It is considered part of the school district.
Yeah, so they are. I'm happy to meet and talk with them, or if it's just a conversation. I get the pushback. A lot of it is time, but if we could offer helping resources and you could just quote the ed code. So it's all public schools. Yeah.
Got it. Thank you for that.
Yeah. And I do want to introduce Karen. She's our new health programs policy specialist and will be helping with the school coordinator. So Karen Jacoby was a program consultant, but she will also be helping us with this effort of school dinner programs. So
thank you for that.
You're welcome.
Have a good day.
You're welcome. I'll stay on if anyone else has any more questions.
Thanks, Paula.
Hi, this is Monica from Santa Cruz County. I just wanted to follow up on the comment about the work plan and success story dissemination plan being due in June. I just wanted to make sure that I had the correct information about which objective that was for.
Yeah, so on Appendix 14, I just linked it to your comment in the chat. You can open that up and check out which of the success story dissemination plans are due in June. I'm opening it up myself so I can share the screen and show you.
I see. I think I didn't have the most updated Appendix 14, possibly.
Okay.
Thank you.
Oh, no problem. Do you want me to share my screen again, or you got it?
I got it. Thank you.
Okay, awesome. No problem.
This is Andrea from El Dorado County.
Hi.
Hi there. I was wondering, do you guys by chance for these dissemination plans, is there like maybe a example you guys have that you guys could share with us from a previous year or something for those that are new to this? I don't know if I've done a dissemination plan before. Just wondering if you guys have some guidelines on how that's supposed to look like.
Yeah, I know that our office is looking at some templates, so let me look for it and get back
Perfect.
to you.
Wonderful. Thank you.
Yeah.
This is also going to be something we're talking about a lot at the in-person convenings that COHTAC is hosting in Bakersfield and Sacramento. So we'll be talking a lot more about what the success stories are and how you might work on the dissemination plan. I think in short, we don't have a template for you, but I don't think it has to be that sophisticated either. It's really just thinking about what are the success stories you want to share and how are you going to do it. So yeah.
Thank you so much. And I'll be at the Sacramento one, so that'll be good.
Excellent. All right. Well, we'll capture all of these questions and comments and put them on our event page and share them out with you all later. Seeing no other questions come through, I think we can call it a morning. Thank you all for being here and for sticking around a little bit later to get some of those questions answered.
Excellent job, Aubrey. Nice seeing you
Oh,
all.
thanks. Yeah. Happy 2025.
That's
Been
right.
a year
Aubrey,
already.
great meeting. Thank you so much.
Yeah, thank you all for being here. Take care.